Live from 42nd and 2nd, this is the Pix 11 Morning News.
Plus, what's good for you and what's not. After the break, we're breaking down the food all men should have in their diet to have a long and healthy life. They're putting Craig, Byron, and I to the test.
That's right. Get ready. Okay, so November is Men's Health Awareness Month. It's also the time of year when we elect our health benefits. And as we gear up for 2018, this is really a good time as well to make sure we are on top of our health, especially men who are less inclined to go to the doctor. Yeah, unfortunately you are. Well, this morning we are addressing all of this with the help of Dr. Geo Espinosa from NYU Functional Urology. He's going to help us separate fact from fiction. Thanks for being with us, doctor.
It's my pleasure.
All right, so why is it that men don't want to go to the doctor?
Stubborn vulnerabilities. Men don't like to be in vulnerable situations, so that's one of the main reasons. And plus, they're too busy, quote unquote. So they're too busy for, to do preventative work.
Well, you should never be too busy to make sure that your health is number one. But what are the main health concerns for men?
Well, the top three causes of male deaths are, heart disease, cancer. Those are the top two by far. The third is actually, most people would think is strokes or diabetes. No, it's actually accidents.
Really?
Accidents related to things like car accidents and even drowning. Those are the top causes.
All right, so we are going to recruit some of our morning show men. These are the men of the morning here on Pix 11. Hey, guys.
This was the dating game. What
happened to that?
And behind door number one. No, I'm just kidding. Actually, so we're going to put you guys to the test, right? So, fact or fiction, 1 out of 16 men will develop prostate cancer in their lifetime.
Oh, that's a fact.
Dr. Geo?
That is a fact. 1 out of every 6 men. And interestingly enough, 50% of men will develop some type of cancer during their lifetime. That's 1 out of every 2. Interesting.
Okay.
Can I just say?
Yeah.
I'm a prostate cancer survivor.
Oh.
Get checked out.
Yeah.
Do it.
Yeah.
Get it done
so
early.
Important.
Yeah.
Is there an age you're supposed to get checked out?
That's controversial. Roughly 40 if you have a family history. If you're African American, you should start at 40. If not, 45 to 50.
Okay, got it.
All right, so get checked out, gentlemen. Okay, so here's our next question. More men die from Alzheimer's disease than women. Fact or fiction?
Ooh, I'm going to say fiction.
Fiction.
Dr. Geo?
Most men, out of the top 15 causes of death, most men die from all those 15 causes, with the exception of Alzheimer's. More women die from Alzheimer's than men.
Fiction. Okay, got it. I'm wrong.
I got it right.
So is there anything that people can do in their 20s, 30s, and 40s to help prevent Alzheimer's?
Sure. So that could be a very long story, but I'll tell you, there's some key nutrients that are important, things like vitamin D. You want to have your levels checked, and it should be roughly between 40 to 60 nanograms per milliliter.
Ginkgo biloba?
Ginkgo biloba is good for memory, not so much for the prevention of Alzheimer's.
Okay, here's the next question. Life expectancy for women is 81 years, and for men, which is up to 83 years. Is that fact or fiction? And keep your cards up, because we want to make sure.
Fiction. That's fiction.
Everyone says fiction. Is that true, Dr. Geo?
That's true.
Oh.
All right.
Life expectancy for men is 76 years, and for women it is 81 years. So they have us 5 years. They have 5 years on us.
Okay.
Why is that?
Again, women seem to be more proactive, and they do less things that are risky, less suicides and less car accidents amongst women.
I thought you were going to say we're better human specimens.
I thought.
I have 2 daughters, so I like to think that is the case.
Okay, very good. Well, Dr. Geo, thank you so much for joining us. And guys, great job.
Wait, so we're dying earlier.
Yes.
We are.
Yeah, okay.
We are.
I think it's because the women drive us crazy.
Well,
Well, it'd be a short trip anyway.
I'm working on that, Dan. I'm working on it. Don't you worry. Okay, thank you, guys.
My pleasure.
And of course, men out there, make sure that you take part in this Health Awareness Month, as that it's November. And even though it's coming to an end, it's important that you make sure to take control of your health year-round.